Hi, my name is Alicia Bembenek, and this is health assessment number 3. We're going to be going over the abdomen and range of motion of the muscular skeletal system and also the reflexes. Go ahead and scan the room here. And Jake will be assisting me with this health assessment today. So first we're going to start off with the abdomen. First you just want to inspect the abdomen before you touch it or do anything else. So you're looking at the symmetry of the abdomen. You're looking for any bulges, hernia. You're also looking at the umbilicus, the belly button, to see if it has any hernias in that area. You're looking for stretch marks, any coloration, and you're also looking for pulsation in the aortic area. So once you assess the abdomen, then you can go ahead and auscultate the abdomen. I'm going to go ahead and have you lay down. I'm actually going to scoot this forward a little bit, make it easier for everyone to see. Okay, so we're going to go ahead and we're going to listen to the 4 quadrants of the abdomen. You want to listen for hyperactive or hypo ball sounds. You'll hear kind of tinking or ball sounds about every 5 seconds. If you hear them faster than that, you would consider it hyper. If you don't hear anything, you need to wait up to 5 minutes of assessing to actually call it hypo ball sounds. So I'm going to go ahead and I'm going to auscultate. And I have tinking in all 4 quadrants. So I would consider his ball sounds to be normal. From there, we're going to go ahead and we're going to listen to the vascularity of the abdomen. We're going to start with listening to the aortic area. On very slender people, you can see a pulsation right midline above the umbilicus of the aorta. I'm going to go ahead and listen. You're listening for bruits or hums. From there, I'm going to listen to the renal arteries. You're going to go right below the 12th intercostal rib there, and it's about mid-clavicular line down. And on the other side, once again, the renal arteries. From there, I'm going to listen to the iliac arteries. We're going to go mid-clavicular line down the abdomen below the umbilicus, and that's where we'll hear the iliac arteries. Okay, and then we're going to assess the femoral arteries. I'm just going to touch right there and go up. And other side. After you auscultate the abdomen, you can go ahead and percuss the abdomen or palpate the abdomen, whichever you prefer. We're going to start off by percussing the abdomen. So on the right side here, we're going to percuss the liver. We're going to start from the umbilicus. And we're assessing that tympanic noise to go to a dullness noise. And once we hit that liver border, then we're going to move up to about the 10th intercostal space. From there, we're going to assess for the dullness. And it's going to be about 7 centimeters, the measurement of the liver. We're going to go ahead and go over to the other side, and we're going to palpate the spleen. So you're going to want to go right underneath the 12th And you shouldn't hear anything there. If you do hear a dullness, that could mean that you have an enlarged spleen. So we're going to go ahead and we're going to move up and just assess in the 10th and see if we can hear dullness in that area where the spleen would be noted. Okay, from there we're going to go ahead and we are going to palpate the liver, and we're going to palpate the kidneys, and we're going to palpate the spleen. Let me know if you have any tenderness or any issues with this. So with the liver, on the right hand side there, you're going to kind of curve your fingers a little bit and feel upwards. And go ahead and take a deep breath in and exhale. And you should be able to feel the lower border of that liver. Okay, I'm going to go ahead and I'm going to go on the left-hand side, and I'm going to feel for, I'm going to come around here. I'm going to feel for the spleen. So, same kind of thing. Deep breath in and exhale. In here, you shouldn't be feeling anything. If you are, it could be a sign that the spleen is enlarged. I'm going to go ahead and I'm going to palpate the kidneys. Some pressure here. Deep breath in and out. Okay. And on the other side, the same technique. Deep breath in and out. Okay. I'm going to go ahead and I'm going to do some light palpation on the abdomen and then go ahead and do deep palpation. The reason you want to do this is you want to make sure that the patient isn't guarded when you are doing the palpation. You're checking for any tenderness, any bulges. You're looking for lesions, if they have any rigidity in the palpation. So I'm going to palpate. Let me know if you feel anything, if it hurts. So on the right hand lower side is where the appendix, so if you palpate there and they express that it's tender, that might be a sign of that they have an issue with their appendix. And then I'm going to assess the lower left side of the patient. This is where you find the colon. Sometimes they'll have some tenderness there. That's normal, but it shouldn't be painful for them. So now that we've assessed the whole abdomen, I'm going to go ahead and I'm going to start assessing the musculoskeletal system. I'm going to have you go ahead and sit up for me, face the computer. Go ahead and scooch back just a hair. Sorry. Okay, so when you're assessing the musculoskeletal system, when you're assessing the musculoskeletal system, you're looking at the alignment, you're looking at the contour, you're looking at their muscle mass, the symmetry of it. You're also going to be looking at the bones. So we're going to look at the neck, the shoulders, the elbows, the wrists, the fingers, the spine, the hips, the knees, the ankles, and the toes for this assessment. So we're going to go ahead and jump off right away with palpating the different joints. We're assessing for any crepitus or any discomfort when we're palpating the joint. Any discomfort there?
No, ma'am.
Okay. And on this side?
Nope.
Okay, no crepitus noted. And palpate this joint. And your wrist. Okay. And move to the other side, palpating the elbow and the wrist. Okay, I'm going to go ahead and palpate your knee. No crepitus. And I'm going to palpate this other knee here. No crepitus. And I'm going to go ahead and feel the ankles down here. Yep. Okay, another ankle. No tenderness?
Nope.
Okay. And no crepitus noted when palpating those joints. We're going to go ahead and move into the range of motion of the neck. So the first thing I'm going to have you do is put your chin to your chest. This is forward flexation. Go ahead and bring your head back up for me. And all the way back. And this is hyperextension. I'm going to go ahead and have you put it straight up. And then I'm going to have you go right, all the way to your shoulder. No, bring your head down. There you go. and all the way, there's some crepitus there, all the way to the other side, please. Okay, and that's lateral range of motion. And then I'm going to go ahead and have you do, like you're going to circle your neck all the way around. We're looking for any stiffness, any cracking, if there's any tenderness or pain with the movement in that. So once we do that, we're going to go ahead and we're going to test the sternocleidoid mastoid muscles. So I'm going to have you go ahead and push against my hand, like you're going to look down. Good. Okay, stop. And I'm going to have you push back. Okay, good, and stop. And then I'm going to have you go ahead and push against my hand like you're turning your head. Good, stop. And to the other side. Good, stop. Okay, so now that we assess the sternocleidoid mastoid, we're going to go ahead and we are going to assess the range of motion of the shoulders. I'm going to have you roll your shoulders forward first. Okay, and go ahead and roll your shoulders backwards. Okay, I'm going to have you, and that's forward flexation and backwards flexation. I'm going to have you go ahead and lift your shoulder out. So this is abduction. Go ahead and put your shoulder in. And that's adduction. So go ahead, out, rotate out, abduction, induction. Okay, so now that we went over the internal and external rotation, abduction and induction, we are going to assess the bicep strength, the tricep strength, and the deltoid strength. So what I'm going to have you do is I'm going to have you put your arms up like you're going to flex, and I'm going to pull against you, resist me, okay? And then I'm going to have you go ahead and push against me. And that's checking the triceps, and we checked the biceps before that, good. Now I'm going to have you put your hands straight out in front of you, and I'm going to press down and resist me. And we're assessing the deltoids there with that resistance. So now that we went over the arms, I'm going to back up here so you can see me. Now that we went over the arms, we are going to assess our elbows. I'm going to have you put your arms out, okay, and bend your elbows straight and up. Good. So have you put it straight out. So this is supination with the hand up, and with the hand down, we're assessing pronation. Good. Now this side, elbow, bend up, flexation, extension, supination, pronation. Any tenderness or issues with that range of motion?
Nope.
Okay, and we already assessed the strength of the elbows when we assess the biceps, the deltoids, and the triceps. So we're going to go ahead and we're going to move into the wrists and assessing the wrists. So I'm going to have you make a tight grip on me, as tight as you can. Okay, I'm going to have you put your hand up and all the way down. Okay, and I'll have you do a rotation of that joint. Same thing over here, hand up and down, resist against me, push against me, good. And a full rotation with that one. Good. So we checked the strength and we checked the joint there. I'm going to switch you back here just a tad. So we're going to move into assessing the fingers. So I'm going to have you press against me with your fingers, okay, and press up against me. Good. Okay, try to spread your fingers apart. That's abduction, and then I'm going to have you, I'm going to try to pull your fingers apart, okay? This is adduction. Good, I can feel it. I'm going to go to this side. Same thing, press against me, okay, resist me, okay, try to spread your fingers, okay, and the opposite, press against me, good. So now that we assess the hands and the wrists, we are going to move into the hips. So for this, I'm going to need you to lay flat on this.
Stomach or back?
Supine, so on your back. Yep. So we're going to start first by looking at 90 degrees. I'm going to have you, with your legs straight, lift your leg up towards your head. And that's 90 degrees. Okay, go ahead and put down. And then I'm going to have you bring your knee to your chest. And this, we're assessing the hip, and that's 120 degree. I'm going to rotate you in externally, and I'm going to rotate you out externally. Okay, I'm gonna have you lay your foot flat. And then I'm gonna have you point your toe to your heel, rotating your hip. So there you go. Okay, and the opposite direction. Okay, and this other leg, lift the leg straight up as far as you can. And that's 90 degrees down. And then we're gonna do 120 to your chest. Good. And then I'm gonna rotate out. Good. And in. Awesome. Go back down. And then we're gonna go internal rotation of the hip. And then external rotation of the hip. Okay, so I'm going to go ahead and I'm going to assess the strength of the hips. Can I have you scoot up just a hair here?
This one?
This way. I just want to make sure that you can. Okay, I'm going to press against your legs, and I want you to lift your legs like you're bringing them up to your chest, okay?
Both of them?
Yep. And we're assessing the strength of the hips there. That's good. Okay. And so once we do that, we're going to assess, I'm going to put my hands on the outside of your knees. I'm going to have you push outwards. Good. And I'm going to push and you resist me. Awesome. Okay, I'm going to have you go ahead and sit up for me. Sorry, a lot of up and down. Okay, I'm going to have you cross your legs.
Good.
Yeah, put your knee over this one. Can you do that for me? Yeah. Okay. Okay, and then switch to the other side. Okay, we're assessing the gluteal muscle and the hamstrings. Good, you can stop that now. We're assessing the gluteal and the hamstring muscles with that. We're going to go ahead and we're going to move into the range of motion of the knees. And I'm going to scooch you back as far as I can so we can see here. Okay, so I'm going to have you extend your legs out from your knees. Good. And then I am going to have you put your knees in. And that's flexation and extension there at the knees. I'm going to move to the side. So we're going to go ahead and we are going to assess the strength of the knees. In doing so, I'm going to push down, and I want you to resist me, so put your legs out, and push down, okay, and push against me. Awesome. Good strength in both of his legs. So from the knees, we're going to move into the ankles. I'm going to angle the camera down further so we can see here. Okay, so on the ankles, I'm going to have you, we have a visitor, sorry. I'm going to have you rotate the ankle in and out, and can you do a circular motion for me? Awesome. And on the other ankle, the same thing, circular motion. Okay, press against me. Okay, and resist me. Awesome. We have good, I'm going to put the screen back up here. So we have good strength in the ankles as well. From the ankles, we are going to move into the spine. So I'm going to have you turn around and sit backwards for me. So when assessing the spine, we're looking at the curvature of the spine. We're going to palpate the spine. If there's any tenderness, any bumps, masses, rigidity, or guarding when we're touching the spine, if there's any pain within the spine, I'm going to have you go ahead and stand up for me. Okay, I'm going to have you bend back as far as you can. Good. And then I'm going to have you bend forward and try touching your toes. Awesome. Stand up. I'm going to have you lean to the right as far as you can. Lean to the left as far as you can. And then with keeping your pelvis stable, turn your body to the right. Yep. And turn your body to the left. That's fine. Looks good. And go ahead and bend over for me again. And we're looking at the curvature, making sure that it's a straight curve. We're looking for scoliosis there. You can go ahead and stand up for me. So we're going to do some cerebellar functioning. So I'm going to have you walk. You can turn around for me. I'm going to assess your gait. So I'm going to have you walk heel to toe towards the camera and back. Heel to toe. Awesome. And you can turn around and walk back. Okay, and you can stop. Maybe face the camera and back up a little bit so they can see. Okay, we're gonna perform the Romberger test. So I'm gonna have you look at me. Okay, with your feet almost together. I'm gonna have you close your eyes. And we're looking for their balance there. So you can go ahead and open your eyes, sorry. So we're gonna go ahead and we're gonna do the rapid movement. I'm gonna move the camera down so you can see. Go ahead and sit down for me. And I'm gonna have you take your heel and rub it up and down quickly on both sides, back and forth. Yep, and another one. Good. So the rapid movement is good on that. We're going to go ahead and we're going to do finger to the nose. So put your hands out, finger to the nose, and opposite one. Good. Go ahead, you can go ahead and put them down. We're going to next assess graphophagia. So I'm going to have you close your eyes, and I'm going to spell a letter in your hand. Can you tell me what letter I'm spelling?
O.
Okay, and the next one?
T.
Yes, good. So from there, we're going to assess light touch and pain. So go ahead and close your eyes. Can you tell me where I'm touching you?
Ear.
Okay.
One. Shoulder.
Okay, and can you feel this?
Yes.
Where am I touching you?
My back. My arm. Elbow.
Okay, sounds good. You can go ahead and open your eyes. We're going to go ahead and we are going to assess the position sense. So using a finger, close your eyes. I'm either going to move your finger down or I'm going to move it up. You tell me which direction I'm moving it.
Up. Down. Up. Down.
Okay, and the other side.
Up. Down. Up. Down.
Okay. From there, you would want to assess the vibration sense, and you use a tuning fork to do so. I don't have a tuning fork, but you would just vibrate the tuning fork and then assess it on locations of the body to see if they can feel that vibration. So, the last part of the assessment would be deep tendon reflexes. I do not have a hammer reflex, but you would want to assess the brachial reflex, the brachial radius reflex, the tricep reflex, the patellar reflex on the knee, and then the ankle jerk. This is going to conclude my assessment number 3. We covered the abdomen, the muscular skeletal system, and the sensory cerebral functions. Thank you.